This is a community assessment of Gulfport, Florida. The first settlers came to Gulfport and built their homes on the beautiful shoreline in the 1800s. In 1904, many attractions were built, including the pier and casino. By 1928, the historical brick paved roads were built, and the Royale Hotel, now Stetson Law College, was built. In 1930, Gulfport improved their drainage systems, water systems, and reconstructed the casino. In the 1990s, Gulfport developed into the city that is known as today. Gulfport housing is very interesting. The homes range from very large, in the Pasadena Yacht Club, to very small homes built away from the water. The median home age in Gulfport is 47 years old, and the median cost is $117,000. There are many housing subsidies in nearby cities, St. Petersburg, Clearwater, and Tampa, depending on what type of shelter is needed. The problem in a small community is that not all resources are available within the community. The people may have to go outside the community for some resources, such as homeless shelters. Gulfport has a city library, a senior center, a casino, and a theater, Catherine A. Hickman Theater, and it's a center for performing arts. The population at the last census was 12,164. The population density in Gulfport is just over 3,000 people per square mile. The population will increase in the winter months due to the amount of visitors from other states and countries coming to Gulfport for the warm weather. The population of white alone makes up for 86.1%, and black or African American is 9.2%. And over 25% of Gulfport's population is over 65 years old. Gulfport does have a senior center that has many health-promoting activities, such as blood pressure checks and a wellness center. The median yearly income for Gulfport is $39,056. But 16.3% of the population is below poverty level. Palms of Pasadena Hospital is an all-adult facility. The hospital does not have an obstetrics department or a pediatric department. This hospital has a range of services: cardiovascular health, surgery, orthopedics. But if you need pediatrics, you have to go to the surrounding communities. There are many private medical doctors in Gulfport, primary care doctors, dermatologists. Availability and coverage depends on insurance. There's only one long-term facility in Gulfport, Florida, but there are several long-term care facilities in the neighboring cities. In Healthy People 2020, STD2 is to reduce the number of females ages 15 to 44 years of age that have chlamydia. Sexually transmitted diseases are the top 3 communicable diseases in the community. Chlamydia is the #1 STD in the community. Heart disease is the leading cause of death in the community. So HDS-2 from Healthy People 2020 focuses on reducing the number of coronary heart disease deaths. Unintentional injury is another major cause of death in Gulfport. So the Healthy People 2020 IVP 11 focuses to reduce the amount of unintentional injuries. The Public Works Department in Gulfport handles the water supply. They inspect water pipes, water quality, maintain the water supply, and read meters. This department also handles the storm drainage systems in the city. The roads are well kept. There's not garbage in the street. There are many recycling drop-off sites, and the Public Works Department has pickup dates for recycling, including yard waste. There are not mandatory laws for recycling. A community garden is in the process of being built. This garden is going to be used to provide organic produce to the citizens of Gulfport. The police department is made up of 28 police officers, including a police chief and detectives. The Marine Patrol is responsible for over 5 miles of the coastline. The fire rescue provides CPR training, fire rescue services, advanced cardiac life support, and pool safety training. The fire department responds to approximately 3,000 emergency calls per year. The main expense in the budget is for public safety, police, and fire department. This budget has been created to maintain Gulfport's goals and objectives that were set by the City Council. There has been special attention The City Council is divided into 5 wards. The mayor is in charge of the council meetings, and he is elected by voters for a 3-year term. The rest of the council members are elected for 2-year terms. City council meetings are posted on the website, and the community is welcome to attend. And there's a time set aside just for an open forum for suggestions on city improvements. Council members have contact information posted on the city's website for easy access. Heart disease is the leading cause of death in the community. Age, smoking, poor diet, and stress are all risk factors for heart disease. The over 25% of the community is over the age of 65, and many community members were observed smoking, making poor food choices, and living in a stressful city environment, and that makes heart disease a risk factor for Gulfport's community. With age, arteries can become damaged and narrow, and that increases the risk of heart disease. Smoking damages and constructs blood vessels, and diets that are full of sugar, salt, and fat can increase the risk of heart disease. Cancer is the second leading cause of death in the community. There are many types of cancer, but skin cancer is a major concern for Gulfport's community because of the large white population, and a risk factor for skin cancer is fair skin that freckles or burns easily, and sun exposure. And due to Gulfport's sunny weather and beautiful beaches, that offers many opportunities to have a lot of sun exposure. Lung cancer is another concern. Smoking accounts for over 90% of lung cancer. And because of the amount of people that were observed smoking in the community, that makes lung cancer a concern in Gulfport's community. Nurses can promote health with smoking cessation programs and sun exposure safety. Injuries are another cause of death in Gulfport, and injuries include drowning, falls, and poisoning. About 10 people die from drowning every day. With the surrounding waters of Gulfport, drowning can be a hazard in this community. The top 3 communicable diseases in Gulfport are sexually transmitted diseases. Chlamydia is the #1 communicable disease in Gulfport, and chlamydia and gonorrhea both can be difficult to diagnose because many times there are no symptoms. HIV is the 3rd communicable disease in Gulfport, Florida. In 2010, 42% of people that were diagnosed with syphilis were also diagnosed with HIV. So education programs involving safe sex practices can reduce the infection rates of those sexually transmitted diseases. Respiratory diseases can be asthma, influenza, COPD, and that's the 3rd leading cause of death in Gulfport. Respiratory disease programs can include asthma control, influenza protection, like getting influenza vaccines, and managing COPD. Community issue number 6 is poverty. Poverty has been linked to poor health in many ways. The cost of doctor's fees and medications can be a burden for patients. Many people who live at or below the poverty level do not have the means for transportation costs to get their health care. and some people have to choose between feeding their family and their health care costs. In Gulfport, 16.3% lives below the poverty level. Nurses in the community need to make sure that cost is addressed for patients in order to get proper health care. Since the health care reform has begun, there has been a huge decrease in uninsured Americans. The Affordable Care Act, or health care reform, is designed to help people have stable health insurance and make informed choices about their health care. The reform makes it unlawful for insurance companies to spend the majority of their premiums on administrative fees and not on coverage. It allows patients to appeal the denial of coverage and makes companies have an approval for rate increases. Coverage is extended to children with pre-existing conditions. Young adults under 26 can remain covered under their parents' coverage, and companies can no longer cancel coverage for application mistakes. It's designed to help you choose your primary care doctor. You can seek emergency care outside of network, and it covers preventive visits at no cost or copay. Many countries around the globe have a health reform of their own. Canada has a reform that's built on distributing necessary medical care and watching limits. Community health nurses need to be aware of the laws and advantages of the new reform to guide clients to better health care.